Hi everyone, welcome back to my channel. In this video, I'm talking about lumbar disc extrusion. This is around 10 o'clock in the evening. I just had a conversation with one of my online clients, Patal, who had lumbar disc extrusion, and she's been working with me for almost 1.5 years now. Patal was diagnosed with quite a big lumbar disc extrusion around 2 years ago, and since we start to work with her online, she didn't got reabsorption up to right now, which is almost 2 years later when she got diagnosed with it. The purpose of this video is to talk about lumbar disc extrusion and just give you some information in regards to whether you need to jump into the surgery after a diagnosis of lumbar disc extrusion or not. In this video, we're talking second time, and this is my second video with Patal. Now we have her before and after MRI scan that shows huge amount of reabsorption, and she's almost symptoms free, back to the gym, training pain free, and she's going to share with you what she's done over the last 2 years after she's gone diagnosed with this injury. And Patel is a special client because she works in MRI center and she has access to the MRI scan quite in a day-to-day basis. She basically scan people in a day-to-day basis, 7 to 8 people in a daily, and she's talking about how common is this bulges, this extrusion and herniation is, what she's done so far that helped her to get to this stage that she's totally symptoms free. She has on and off pain here and there, but she's fully active. She can train in the gym. She can do day-to-day activity that she used to have, and she's quite in a very comfortable zone. If you suffering from lumbar disc extrusion, this video it's built for you to gain more information. Please watch the video until the end. At the end of this video, I have shared with you a couple of movements that Patal has been doing in her routine in a day-to-day basis every single day. Sometimes once, sometimes twice. I hugely recommend you to watch this video until the end. If you have any question regarding your injury, if it's lumbar disc bulges, herniation, or extrusion, you can leave me comments. And if you are considered to go for surgery for lumbar disc extrusion, I have shared with you underneath of this video says of patient that I have had online who has recovered from lumbar disc extrusion through following a rehab plan and just spending more time, which means just give your body time to heal itself, is a huge deal. If you find this video helpful, make sure to subscribe my channel for my weekly update and do not forget to press that like button. Let's get started. Patal, thank you for time for today. This is our second video that we're recording for people who's watching and following my YouTube channel. Today we have a kind of like a stepping point that you got your latest MRI scan that we're going to share with people shortly, and we're going to review your MRI scan because you end up having the reabsorption that we were waiting for it for a while. But before we go through the MRI scan, maybe let's discuss about a little bit about yourself. How did you end up contacting me in the first place, and then we can move on. Would that be fair?
Yep. So I injured my back 2 years ago. So I'm an MRI tech. I work in the hospital. So probably while moving the patient, I think I might have injured it. And then I had my baby. So being with him, sitting, feeding, and then starting work earlier because I didn't took long maternity leave. So I think with all that, I injured it, and then it progressively got worse. So I did a physical therapy here, but here we just only get about 6 weeks of physical therapy, and that's it. They'll just give you regular exercises and stuff like that. So my symptoms were just left side pain, left side hip pain. I didn't have not much tinglings, numbness, nothing like that. And I found it accidentally. I'm MRI tech, so one day they wanted to test the machine and test what was going on. So I volunteered, and then I found that. So
Okay.
I was like, okay, maybe that's why my hip was hurting. And once I found it, it was in my head since then. So
Got
I
you.
did the physical therapy for 6 weeks, and yes, I would say I was okay, but then I wanted to do something that would help me long term. So I did the YouTube videos and stuff, but then it's like, with the YouTube videos, you just do it whatever they tell you. You don't have a consistency. And then I saw you on a YouTube and I saw a lot of
Mhm.
testimonials and I followed you on Instagram. And then with this internet, there are a lot of scams going on.
Of
So I
course.
was
Yeah.
skeptical too. I'm like, I don't know. I talked to my husband and he's like, well, online, how he's going to teach you the exercise, how he's going to manage that. So I
Yeah.
was like, well, I need to give it a shot because I need to get better. So
Exactly.
then I contact you. We did the first meeting where you asked me what was going on, this and that, and then we started with the plan. So I think within 6 months, I did feel better. But as I say, I'm an MRI tech. I see this every single day. So
Exactly.
I was expecting that it's gonna reabsorb really quick after you do
Pretty
the exercise.
fast.
No,
Yeah.
it doesn't happen that
Do
way.
you recall when did you got your first MRI? Was it that? Do you know roughly when was it
I
exactly?
think it was my first one was in end of 2022. Yeah.
Okay, end of 2022. Okay.
Yeah.
And then from then, you basically every 6, 8 months, I do remember you were just getting.
Yeah, so the first MRI when I got after my baby, when I started working, it was end of 2022, and then I think in 2023 in the May I contact you. So
Yes,
then every 6 months I used to get my MRI done, and I'm like, there is no reabsorption happening, Bob.
oh
But
no,
then you always told me that it's in your head. If you're not feeling nothing, your symptoms are getting better. It's gonna happen. Just give
absolutely.
time. So that's true. Once if it's in your head and if you keep on thinking not no reabsorption, no, it's not gonna happen. So
I
just do
know,
what you
I
do every
know.
day. So that's what I
Exactly.
did. And
Which means
then
the first thing that we could say that like I had, it's really interesting because I had these clients of mine yesterday who sent me his new MRI scan. Similarly to your case, it took almost 2 years to reabsorb. I'm
mhm,
actually sharing his results in a couple of weeks' time, similar to your results. But yeah, it can take up to from 18, sometimes to two, basically years, 18 months to 2 years, which means that's the data that we have on the research. And you should just, I mean, as far as I see, many people like you who recover and they get reabsorbed. Like the data that we have, it shows 70% of people do get reabsorption, and there is a partial, let's say that 30% that who don't get the reabsorption, but they still have symptoms reduction, which is very interesting. Which
mhm,
means even though if they don't have reabsorption, they still have functionality, and their symptoms get better. Which means, I suppose, the one of the things that we can highlight here, if you do have disc extrusion, and if you have a quite a big extrusion, what research highlighted so far, it's
happens.
good. Absolutely, it reabsorbs faster. The bigger the extrusion is, it's reabsorbed faster. Don't rush to jump to the surgery or
Mhm,
anything invasive. This is a new motto that I try to really promote to patient with extrusion, particularly, and herniation and the big actually disc bulges. Um, and just be patient. Your symptoms will improve. If you have only certain type of symptoms that we discussed before, like let's say Cohen syndrome, that they're very obvious symptoms, which means you can't miss them. They're
mhm,
numbness, severe numbness, or bowel bladder dysfunction, or sexual dysfunction, or let's say numbness that causes weakness or foot drop in one side or both sides. You definitely want to check urgent. Okay, Patal, out of the first question that I ask you, is there anything else that you'd like to add? You mentioned about, okay, you did have some sort of fear to contact me, and there's a lot of people still in my YouTube channel, even though there's 100 testimonial there from 100 different people
yeah.
online right now. There's still a lot of people who still doubt about the plan, and they think this is fake. I paid you guys, or I've invested
No,
in somehow.
no,
Seriously,
no,
I still get this question, which is crazy.
no.
But I
Bothers
just want
me.
to
No.
know. Yeah, I just want to. You basically a person who lives in the US and you work in an MRI center, which is in a
Yeah.
hospital, and you basically see this every single day. Maybe just give some, I suppose, projection for people who watching this video. How common are these bulges?
They are very common. Like if I do in a week, if I do 15 to 20 patients, probably half of the patients have those symptoms because that's what we usually scan for that, like for disc herniation, bulging discs, and numbness in legs and things like that. So usually my day is I scan probably 8 or 9 patients. Out of 8 or 9 patients, 7 patients are there for the same thing.
Wow,
So it's very common. And then the first thing is like, I would be like not ignoring the symptoms. If you tried everything,
of course.
try to contact Bob. He will
You're
definitely
very
help
kind.
you.
You're very kind. Obviously, I would
No,
be happy to
yeah.
help them.
I'm like,
But
if you're thinking to go for surgery before going there, because once you mess with your back, you're gonna keep on messing.
absolutely.
So it's like you try whatever you can, and I'm like, if this is your last shot, just give it a try. You know,
Thank
you
you.
already spent so
Yeah.
much money. Why not here too? I mean, if it's gonna be improving, because I did that too. I did a couple of therapy sessions,
Yeah, I was
and
just going to ask you, yeah,
yeah,
what
it's
was your
very
experience
expensive
before
here.
you contacted me? Yeah. What was your experience? Like, what did you do actually before you contacted me?
Here in US, when we do go therapy, they just give you only for 6 weeks. That's it. Then
Hmm.
you they would be like, just repeat those exercise, whatever we gave you. That's it. They
Yeah,
don't give you any more than that. Because then they're like, okay, your symptoms are getting better. You don't need nothing. But it's
I
not
got
that.
you.
You need a routine. You know, I'm a person that if I have a routine set for me, then I know what to follow. And I know
Exactly.
what exercise to do. What's gonna be like if I overdo it, or if I do too much of, if it's gonna hurt or not. That's what my fear. I was fear for doing even squats, because I'm like, I'm bending my knees
Yes.
and my back. I'm like, I was always afraid that okay, it's gonna bulge out more.
Squatting. Yeah,
Yeah.
obviously. Yeah. And how did you find, I suppose I suppose did you got any treatment, physical treatment as well for it? Did anybody work on your back
I
or as
I
such?
I did decompression therapy.
Uh-huh.
Yeah,
That's
I
very
did.
common. That's very
Yeah,
common
I
all
did
around the world. Yeah.
10 to 15 sessions, but as I
Mm-hmm.
said, I didn't have bad symptoms, so I don't even know if it worked for me or not.
I got you. Yeah.
But yeah, I tried decompression, I tried physical therapy. So yes, the exercise and physical therapy did help, but then after 6 weeks, okay, what do I need to do now?
Next.
Is
Yeah.
once you are set with those exercise, you need to step one ahead. You need one more step to get it
Absolutely. Yeah.
much better, much stronger. So at that point, I saw your video and then I contacted you.
Okay, that's a very good point that you highlight here, Patal, because it's a big error that a lot of people don't understand, which means the goal of the rehab plan that we work together is not all about just reducing your symptoms. It's
No.
about improving your day-to-day lifestyle and progressing your day-to-day lifestyle to the full capacity, which means one of the typical things that I see with people with back pain is that they only focus on getting pain-free
Mhm.
and that's it. We
That's it.
don't want to only focus on getting pain free because that's not going to give you long term results. If you just aim for that, you maybe reduce your symptoms and improve your symptoms, but you never regain that confidence, physical and mental confidence that you should have to squat, lift, twist, bend, and all day to day activity. And I think that link from very basic exercises to progression is missing in most places.
Mhm.
And there's no customized plan for people to literally get that help. And okay, and which means you don't want to just focus on getting pain free. You want to progress your plan and improve it to the full capacity. Then, since we start our plan and your plan with me, how did you find the plan? Maybe give people some insight.
So the initial plan, we started with less intensity. And then once I was like, I didn't have that much symptoms. And then once I was comfortable, we went up with intensity. So like for first 12 weeks, we were like moderate, not too much. And then since then I was, it was everyday routine. So then we went up. So I like that you're not in the same plateau. You that
Of
once you are
course.
in the plateau, then you go up. So it's like helps with my strength, my core strength, my overall strength. It helped.
Absolutely, which means one thing was that it was not only just a matter of doing something, it was you could see
Mm-hmm.
as a patient that I'm progressing, which means that help you to physically and mentally regain that confidence again, that I can actually do better from comparison to 6 or 8, 10 weeks ago. Second was that we didn't only focus on your back, be
Yeah, we
focused on your
focus
whole
overall.
body. And that's another thing that I see hugely people do not understand. The rehab plan about your back should not only focus on your back.
Mhm.
And if you're only focusing on your back, you're not seeing your whole body as a system. And whenever you want to utilize, I don't know, upper body or lower body, you're gonna get caught in some stage in life. And by practicing those movements in your rehab plan, you're rebuilding that trust again. And okay, then fast forward, Patal.
Also, I
You got
wanted to
yeah,
add
good.
with your rehab plan, I didn't know how much stress was affecting my
Mm,
recovery because I noticed more stressful the day would be, or more stressful if I would keep on thinking about why is the reabsorption not happening, and I keep on stressing out.
yes,
It was not helping me.
yes, yes.
So
Well, that's
I
thank you
didn't
for
know. I
highlighting
didn't know
that.
that
Yeah.
how stress affected the back too. Yeah.
100%. That's a very valuable feedback, Patel, and thanks for that. Because generally speaking, people are not always aware of okay, what are the factors that hugely
Mhm.
impact their pain and their symptoms. We mostly been taught that activity and load and things that are not necessarily supposed to be done day-to-day basis, lifting, twisting, can aggravate your pain. But what we measure in our rehab plan, as you highlighted, we measure much more than just activity. We measure your sleep, we measure your stress level, we measure your day-to-day activity, we measure your even social activity, which means do you have a social life? We measure your like diet plan, which means what do you eat actually? Which means
Mhm.
all of these factors are things that can impact pain. And as you highlighted, stress was something that was huge for you, which means whenever you were saying, I'm getting stressed, my pain and symptoms changes. All
Yeah.
right. Like beside the stress, how did you find measuring things, Patel? Like because we measure everything in the plan. We measure your pain. We measure your walking distance, for example. We measure your sitting time, for example. How do you find that?
It was like so. I usually go for a walk, but with your plan, when I had a workout day session, and if I walk too much, it would be too much for me. So I didn't know that because I
Mm,
already worked out in the morning. I already give my body all that exercise, and then in the evening, if I do too much of walking or things like that, it would
yes,
hurt my back. So I didn't know that okay, doing too much can can bother you too.
absolutely.
So with your plan, I'll be like I'll walk one day, then when it's my workout day, I'll take it lighter since I already stressed out, did all my workout in the morning.
Yes, yes.
So measuring was, and then I would know how much I'm working out, how much steps I'm doing.
Which
Because I
means you
remember
have.
I told you I started inclining, and then it started
I
hurting
know.
my back
I
again.
know. I know. That was a interesting one because it's correlated with this question as well. Like maybe just explain for people what happened actually.
So I was the days when I was not working out, I did the regular walking on the machine, and I did
On the treadmill.
inclination. I went up. I did inclination up to 9 or 10 with the normal speed, but I'll do it
Yes.
for about 20, 30 minutes. So I did
Mm-hmm.
that about a week, and then in a week I was like, okay, why is my back getting sore? What's going on? Why my hip is hurting? And then when I talked to you,
Exactly.
you said that don't do that. It's too much. So I didn't hear
Exactly.
that.
Which
So
means
like
which means
beginning,
measuring things that you do and what you
yeah,
do can hugely impact pain. And
Yes.
sometimes something as simple as that can impact the pain, but you're not necessarily damaging anything, but you
No.
spicing the pain.
Yeah.
And while you're measuring it, it's much easier to trace them
Yes.
and be
You
able
know
to figure
what's
out
going on.
exactly. And that's hugely important. Why? Because if I have a patient who do not really track things, it would be very difficult to
Mhm.
from my perspective as a therapist to be able to help them. That's why having that structure hugely help you to be aware of it, and you become independent at the end of the day. Now, by having somebody like me, Patel, like I suppose you have a bit of kind of duty to follow as well. Like it's a bit of accountability and consistency carry, which means you have to start a rehab plan that you know that Bob gonna see me every 2 weeks, every 3 weeks, let's say, and I'm gonna follow these. Did you find that accountability was important for you in regards to
Yes.
getting results?
Yes, because when I didn't have a plan, I worked out 1 week, I will be fine. The other week, I'm like,
Mm,
okay, I don't have time today. I'm not doing it. But with you, if I have a 2 week appointment and you're gonna be asking me, okay, why did you not note it? What's going on? So I need to
exactly.
know if we need to change your plan. So yes, so then I was like, okay, I need to work out. I need to measure everything so I can be updated. And that also helped with my level of pain and what strength I have now, like if it went
Exactly.
up or down. Like if we started with a lesser weight, now I'm okay with those weights. So with like noting down every day, now I know, okay, I'm okay with 10 kgs, so now I can
For
go
example,
up.
yes.
Yeah.
Absolutely, metricing it, which means from one perspective, it give you a very decent feedback that okay, I can do these easily,
Yeah.
and we always measure that intensity as well. And plus, it gives you a little bit of kind of like I suppose a duty to follow
Yeah.
that keep you in on track as well. Now, um, in regards to progression, Patal, like how far you progressed so far. I know it's been a while that we're working with each other, but the fact is that like I know you've got reabsorption. Reabsorption is part of the process that you recover, but that's your body does that autopilot, which means we do not have a data to say that if you do X and Y, reabsorption would be faster. There are certain anatomic advantages that we know that if you have as a person, it might fasten your reabsorption or higher the chances of having reabsorption. But um, if I ask you how much you progress so far right now, where you at, like in regards to your full capacity?
I am like now my pain just comes and goes if I do certain stuff because I have a kid. He's 4 year old. So
Yes.
if I have to lift him or do anything, and if I'm doing gardening sometimes too much, then
Hmm.
it comes and go. But it's not at that point that I can't do stuff. So
Exactly.
now I would say it's just like if I don't. But yeah, if I don't work out, yes, it does bother me more. So mine is like
Mm,
I have to work out. It's like
absolutely.
no matter what, it's like once you are healed, it doesn't mean that you stop working out. So
Absolutely.
yeah.
That's a great message. That's a great message. And I really wanted to reemphasize this, which means we don't work together to just fix your pain and your symptoms and then you stop activity, which means focusing more about health is the key factor of the rehab plan
Yes.
beyond anything else, which means you want to get healthier because we discuss about a lot of things as I mentioned earlier, and we even follow up on your body measurement and metrics, which
Mhm.
means your body weight, body fat percentage, etc. Now, I mean, diet was is a huge deal in the
Yes.
diet as well. How did you find the diet? And I suppose you did have some changes in your body composition as well, Patal. Maybe just discuss about that a little bit.
Yeah, it's like I used to measure with all my protein intake and everything, so that helped too. So like I know now I have to have at least 70 to 80 grams of protein. So like
Mm-hmm.
protein every meal. So that's what I do now. Before that, I didn't know that. I just knew that, okay, I need a little bit of protein, but not this much
Exactly.
because
Absolutely.
all that helps with your, like, overall with your body. When you're working out, it helps. So, yeah.
Absolutely. Like protein is the building block of our body, and literally any tissue recover by protein, which means our body building block is protein and amino acids. Now, if you do have a particular diet, especially I have a lot of clients who are vegetarian,
Yeah.
who are like vegan, and people who are typically eat very little amount of protein, and that's fine with them, and they got used to it. By understanding that how much protein they need based on their body weight and the activity that they have, it hugely helps them to have more energy, have low blood sugar, and obviously even get fitter and stronger and lose some body fat, not just weight. We're not focusing on weight, but you want to reduce your body fat and adipose tissue, because a higher BMI increase pain, as simple as that,
Yeah.
specifically in lower back pain. Excellent. Patal, is there, I suppose, anything else that you like to add before I go and ask you a last question?
No, I'm like, if anybody is looking for, it's not going to be a quick fix. You have to change your lifestyle. You have to change your diet. You have to do exercise. But yes, if anybody is looking to, a consistency plan, then I would tell contact Bob. Yes.
You're very kind. You're
It's
very
it's
kind.
not fake. I know people, and
I know.
I was saying I was like that too. So I'm not saying that
Yes, of
if people
course.
are thinking it's okay, because
You're very
nowadays you
kind.
don't know. But yeah,
Of course,
so with the
100%.
plan, I would say that helped me. So now that's my day-to-day routine. That's what I follow every day. All the stretches that I have to do, workout. So now I know how to do it. So that helped.
Absolutely. Absolutely. And also you do have someone, if you ever have a question or
Yeah,
doubts, to contact to, which means, I mean, this has happened quite a long, many times, like
I
over
have
this
contact you so
last
much.
2 years. Yeah. But like the good part is that like the most important thing is that I see a lot of patient like who has back pain, and some of the question can be very difficult for you to figure out what's going on. But for me, I've seen that patterns that is
Yeah.
very easy for me to figure out, okay, what it can be the next move for you to get that right.
Mhm.
But I can understand that. That's all. This is the last thing that we're going to go through today out of the our testimonial video, is that if you were going to give people who do have a similar issue with back pain, if you were giving them 4 or 5 tips in regards to things that highly effectively help you to recover, okay,
Mhm.
what would you suggest them if you just come up with your own 5 or 4, no matter how many numbers it is? What would you tell them? What would be your
So
tips?
first thing, don't stress out. Be
Very
calm.
good.
It's gonna be positive, because the more you positive are, because I was not like that too. I had to train myself that okay, it's gonna get better. It's gonna get better. Work
Absolutely.
out every day. Trust the process, because you
Absolutely.
if you don't know, then you have to trust it, and then you have to do that every day. And
Consistency.
eat healthy. Yep, and just keep on doing it. Don't give up. And
Thank you.
once you're healed, it doesn't matter. Don't give up.
Absolutely,
Yep.
absolutely. I love them. That those are all golden tips. Thank you, Patal.
Yep.
I'm really delighted for you, because the fact is that you work in a hospital, you work in an MRI center, that you're a very unique patient for me, who
Mhm.
trusted this process, because you see probably a lot of patients who jump and do different things and do random, I suppose, treatment. And you contacted me from other side of the world, and we got you to the point that you're basically got to the stage that you can do everything. You're in the gym, you're training with the weights, you have your job, you are active, you got the reabsorption, and I'm delighted with that. Thank you for trusting the process and sticking to the plan. Um,
Thank you. Thank you.
no, not at all. Anything else, Patal, that you wanted to share before we finish for today?
No, that's it. Just trust the process and keep working out. If you
Thank you.
stop working out, it's gonna come back. So don't give up, though.
Absolutely, absolutely. The body has its own way, and I'll always try to reemphasize this, that I don't have any magical power or
Everybody is
system.
different. So some people it
Absolutely,
happens early. Some people it.
absolutely. You're
But if you
definitely
keep
right.
on working out, it's gonna happen.
Staying consistent. Thanks again,
Yep.
Patal. I appreciate your
Thank
time.
you. Uh huh. Bye.
Cheers. The first exercise that I'm going to share with you guys in this movement is going to be cat camel. Cat camel is pretty simple, but it's very effective in getting that flexion and extension back to your routine, and your basically back can gently get this movement
in a very even acute phase of your injury. You're going to be on a quadruped position, hands underneath of your shoulder, your knee underneath of your hip. You want to basically relax your back and get to that curved position to the point that feels comfortable. And then we're going to get back to that extension. We want to flex the lumbar spine and the upper back. Hold it there for a few seconds and repeat the extension. Now, sometimes when you go into extension or flexion, your lower back can be sensitive. You want to go within the range that feels comfortable. If you find only that movement is applicable in that stage of time, that can suppose be done without aggravating your symptoms, you can practice that within that comfortable range. Try it for 3 sets of 8 to 10 repetition, 2 to 3 rounds through the day. The following move that we're going to do, guys, is going to be hip drop, which is a really important movement for your hip, because your hip become very stiff as well, and whatever you do that involve your hip can be exacerbating your pain, which means we're going to kind of utilize and open up the hip. You're going to lie down on your back. Most of this exercise can be done in bed, and you can literally start them even as early as you wake up. You're going to open up your arms, and we're going to drop the arm to the side. We're going to go for just a hip drop to either side. Now, usually one side is always tighter than the other side. You're going to practice this movement for 3 sets of 8 to 10 repetition. It's a very gentle move, but it's pretty effective in getting your hip move and open up your kind of like your lower back. You can stay there for 3 to 5 seconds on either side, breathing in and out, and try to practice this as often as possible. The more you do this movement, the easier it gets. You might feel some sort of stretch around your lumbar spine and lower back, which is pretty good. We're going to move on to back extension, which can be beneficial if you're suffering from lumbar disc bulges, herniation, or extrusion. Now, depends on the position of the extrusion or where the disc is actually bulged. Sometimes back extension is not really applicable for you. You have to really consult your physiotherapist, physical therapist, and see, are you able to do, like in certain cases, the extrusion can cause spinal stenosis in your lumbar spine, which means it's a secondary stenosis and cause a lot of narrowing around the lumbar spine, which could be not really applicable for you. You have to consult and see, is it comfortable doing it or not? Now, you're gonna hold your hands next to your armpit. You're gonna gently go to a kind of like 5-10 degree of extension. Hold it there for 1, 2, 3 seconds and slow down. You don't want to really push it too much. There's a lot of weight on my hands and I'm not using my back too much. I'm just creating some movement there. When I get more comfortable, I can come a little bit higher, but I always keep my hip on the ground and don't overextend my lumbar spine. Yeah. Now, the more you do the extension, if you find it is comfortable, it becomes actually easier, you gain more range, and it's pretty beneficial. You can practice it for 3 sets of 8, hold it for a second or 2, and repeat it 2 to 3 times through the day. The following move is going to be thoracic rotation, or literally reintroducing rotation. There are a couple of different ways to doing it. I'm going to show you different variety. The simplest way, you're going to bring your hands around your neck. You don't want to hold it too tight, and you want to rotate the elbows within a comfortable range. You're definitely going to feel some cracking, which is normal. You're going to get that rotation, maybe 5 to 8 repetitions in each side. Change arms, same thing on the other side. If you're suffering from lumbar disc bulges, one of the movements that can be really aggravating your symptoms can be rotation, but you don't want to minimize it, because in some stage in life you have to do some sort of rotation in your lumbar spine, and you can restore it by simply doing this movement. This is the different type of kind of like thoracic rotation. You gotta try and see which version suits you the best. I'm going to show you from the other way. And again, the range is within comfortable. You're relaxing everything, you're breathing in and out, and you're trying this movement for 3 sets of 5 to 8 repetitions in each side.
Thank you for watching this video. If you're suffering from lumbar disc extrusion, as you can see, time is the key factor for your recovery. However, while you're waiting for your body to reabsorb and heal its own tissue, you don't want to go for a complete bed rest. You want to stay active and try to be as active as possible. If you are struggling to where to start and how to progress your plan and your rehab routine, you can always contact me through the link below, and we can have a chat about your injury, discuss your symptoms, and go through your case in details. Even we can review your MRI scan and answer your question that you have in regards to your recovery, and you can book an online consultation with the link below. I personally have a busy schedule, but you should be able to find an appointment in the next 2 to 3 weeks, and we can go through your case and review your scan, your MRI scan, your symptoms, and I can give you feedback how long it takes you to get back to full capacity. You can use the link below, book an online consultation. I will be happy to help. If you find this video helpful, please make sure to subscribe my channel for my weekly update. Like and share this video with your friends and family. If you have any question or concern about your injury, you can always leave me comments with the link below. Until next week, all the best.